If you're taking thyroid medicines and you still feel exhausted, you are unable to lose weight, you feel brain fog, then your doctor is treating the wrong problem. There is a hidden killer destroying your thyroid gland, and 99% of the doctors completely miss it. I am Dr. Anshul Gupta. I have helped thousands of people worldwide reverse their thyroid conditions by fixing this one problem. And today, that's what exactly I'm going to share with you today. Most people think thyroid problems are just about hormones. Either it is low T4 or even low T3. Or people think just switching over from a synthetic thyroid medicine towards a natural thyroid medicine is going to fix their problem. But in reality, the real problem in thyroid disorders, whether it is Hashimoto's disease or hypothyroidism, is not just the deficiency of thyroid hormones, but in reality, it is the underlying chronic inflammation which is destroying your thyroid gland. And until you fix this underlying chronic inflammation, no medication, no supplement, or no diet will truly work for you. And unfortunately for most people, they are not even aware that they have chronic inflammation going on in their body because it doesn't show up on those basic blood work that you are doing for you. But silently, it has been destroying your thyroid gland for a very, very long time. In fact, this chronic inflammation blocks the working of these thyroid hormones in your body properly. And this is what we call as thyroid hormone resistance. And that's exactly the reason even after taking medicines, people feel sluggish, they feel brain foggy, they are unable to lose weight, or they have a bunch of other symptoms going on. Let me share with you this quick story. I had one patient, a 33-year-old female, who was on thyroid medications for the last 4 years. Whenever she will go to her doctor and get the thyroid labs done, they look perfectly fine. But she was not feeling normal. She had low energy. She had brain fog issues. She was unable to lose weight even after trying extreme low-calorie diets. The real problems, nobody checked her inflammatory markers in her blood. And once we worked on those inflammation levels for her, not only did her symptoms improve, but she was able to use less amount of thyroid medications. So that's the power of addressing the underlying inflammation, which can significantly change how you can feel and how your thyroid functions. The next question most people have is that, where is this inflammation coming from in my body? So there are 5 main hidden triggers of inflammation. The first one is food sensitivity. This is a condition where our body starts producing antibodies to various foods we are consuming. Because of the modern agriculture and using lot of insecticides and pesticides and other chemicals and processing of our foods, our body is more and more becoming sensitive to different kinds of food. Specifically, gluten and dairy is the biggest offender over here. Time and again, I see patients giving up gluten and dairy and feeling really good. Unfortunately, gluten and dairy are the 2 foods which are completely different now in the present scenario as compared to 20 or 30 years ago. And that's the reason our body is becoming sensitive to them. The second triggers is toxins. These are all the chemicals we get exposed to in our water, in our air, as well as in our food, which includes heavy metals like lead and mercury, the mold toxins, as well as the plastics which we are using on the daily basis. These toxins directly enter your bloodstream and causes an inflammatory reaction. The third important one over here is overburdened with stress. Chronic stress, which can be physical, emotional, mental, work-related, or relationships. All of this combined together causes adrenal dysfunction and leads to high cortisol level. This high cortisol increases inflammation and destroys your thyroid gland. The next trigger over here is infections, specifically gut-related infections of having overgrowth of bad bacteria, having candida in your gut, or even parasites in your gut does increase inflammation in your body. Plus, Epstein-Barr virus infection and also long COVID is a major reason for inflammation in your body. And the last one is nutritional deficiencies. Most people are deficient in vitamin D or zinc and selenium plus magnesium. These are the nutrients when your body is deficient into. Research says that increases inflammation specifically in your thyroid gland. So now you know presence of any one of these triggers will cause inflammation in your body that is going to ultimately destroy your thyroid gland. But here's the good news. There are proven ways of reducing this chronic inflammation in your body, and that's what exactly I'm going to share with you next. The first one over here is using an anti-inflammatory anti-inflammatory diet, specifically which is focused on your thyroid health. First of all, you need to include foods like pumpkin seeds, which are really very high in zinc as well as magnesium, both the nutrients which are needed by your thyroid gland. Plus, you need to include foods which are high in omega-3s, specifically fatty fishes, chia seeds and flax seeds. Then you need to include a colorful, non-starchy vegetables in your diet, because each and every color in those non-starchy food is an antioxidant which help in reducing inflammation. Plus, Brazil nuts are a good source of selenium. Eating one Brazil nut a day will give you enough selenium to help thyroid inflammation. The second thing you need is specific supplements to support lowering inflammation in your thyroid gland. In these, the most important supplements are vitamin D, which is combined with vitamin K2. The second supplement over here is selenium. Selenium in the dosage of 100 to 200 micrograms has shown in research studies to reduce thyroid inflammation and thyroid antibodies. The third one is zinc. Zinc combined with selenium has shown in multiple research studies it improves Hashimoto's antibodies as well as reduces inflammation in the body. Plus, you need to include high dose of omega-3 fatty acids. Multiple research studies show that high dose of omega-3 fatty acids, specifically EPA and DHA, will help in lowering thyroid inflammation in your body. Now, the quality of these supplements matter a lot because you need to have the right dosage as well as the right quality of these supplements. For that matter, I have created very specific supplements focused on thyroid and inflammation. One is a thyroid balance supplement which has the right amount of zinc, selenium, iodine, L-tyrosine into it. One is Inflammapro, which combines various anti-inflammatory herbs. The link will be in the description for you if you want to buy these supplements. After starting these supplements to help supporting your thyroid gland, you need to start working on your stress. Now, for most people, the question will be, so does that mean I stop working or give up my job? No, that's not what I mean. I want you to actually develop resilient or resistance to stress. What that means is that incorporating a de-stressing routine of deep breathing exercises or meditation practices will help you in lowering the cortisol levels, which will help you in lowering your inflammation. So 10 to 15 minutes of deep breathing or meditation exercise will rebalance your adrenals and reduce the effect of stress on your thyroid gland. And the last thing to reduce inflammation is body movement. 10 to 15 minutes, that's the amount of time that I am asking you to have a body movement exercise, whether it is walking, jogging, running, going to a gym. Research shows just 10 to 15 minutes of regular exercising each and every day will help in lowering significantly your inflammation markers in your body. So now you know exactly these actionable steps that can help lower inflammation in your thyroid gland. So if you are that person taking thyroid medication, still not seeing the results, or you checked your thyroid antibodies and they are really very high, then you need to start working on inflammation. Without working on your inflammation or reducing inflammation in your thyroid gland, your thyroid antibodies are not going to get better. Plus, your symptoms are still going to be the same. But once you address this chronic inflammation in your body, suddenly you are going to see a significant improvement in your symptoms, plus your thyroid numbers are also going to get better. So get started today. First, figure out where is that trigger of your inflammation that you can identify, and then start working on an anti-inflammatory plan that I shared with you. And please share in the comment section what was that inflammation trigger for you that you were able to identify. I hope you like this video. If you do, please like and subscribe to my channel as well as share this video with others who can benefit from this great information. Until next time, take care. Bye-bye.